Question 1. A 68-year-old male complains of sudden onset shortness of breath and chest pain that radiates to his left shoulder. He has a history of hypertension and takes a daily water pill. His skin is cool, pale, and clammy. Lung sounds are clear bilaterally. Vitals: BP 90/60 mm of mercury, HR 110 bpm, RR 24 bpm, SpO2 92% on room air. Which medication is absolutely contraindicated for this patient? A. Aspirin. B. Oxygen. C. Nitroglycerin. D. Morphine. Answer: C. Nitroglycerin. This question tests your understanding of medication contraindications, particularly in the context of cardiac emergencies. The keywords BP 90/60 mmHg are critical clues, indicating hypotension, low blood pressure. Nitroglycerin causes vasodilation, which further lowers blood pressure and can exacerbate shock in an already hypotensive patient. It is typically contraindicated if the systolic blood pressure is below 100 mm of mercury. Administering nitroglycerin to this patient could dangerously drop his blood pressure, leading to inadequate perfusion of vital organs. Remember that while nitroglycerin is commonly used for chest pain, it has strict blood pressure parameters that must be met. Question 2. You arrive on scene to find an unresponsive 3-year-old child who was found submerged in a swimming pool for an unknown amount of time. Resuscitation efforts are underway by bystanders. Which of the following is the most appropriate initial ventilation strategy for this pediatric patient? A. Deliver one breath every 6 seconds. B. Deliver one breath every 2 to 3 seconds. C. Deliver one breath every 10 seconds. D. Deliver one breath only after chest compressions have begun. Answer: B. Deliver one breath every 2 to 3 seconds. This question evaluates your knowledge of pediatric resuscitation guidelines, specifically regarding ventilation rates in pediatric cardiac arrest, which is often asphyxio-related to breathing. The most appropriate initial ventilation strategy for a pediatric patient in cardiac arrest is to deliver one breath every 2 to 3 seconds, or 20 to 30 breaths per minute, without an advanced airway. This higher rate is crucial for children because their primary cardiac arrest cause is often respiratory in nature, meaning oxygenation is paramount. For example, in a drowning victim like this, inadequate ventilation will severely compromise resuscitation efforts. Always prioritize effective ventilation with proper oxygenation for pediatric patients, as their oxygen demand is proportionally higher. Question 3. A 22-year-old male is found unresponsive at a party. His friends state he consumed a large amount of alcohol and may have also taken some pills. He is breathing shallowly at 8 breaths per minute. His pupils are pinpoint. What is the most immediate and critical intervention? A. Administer naloxone intranasally. B. Apply high-flow oxygen via a non-rebreather mask. C. Insert an oropharyngeal airway, OPA, and assist ventilations. D. Obtain a blood glucose level. Answer: C. Insert an oropharyngeal airway, OPA, and assist ventilations. This question tests your ability to prioritize life-saving interventions based on immediate threats to life, specifically airway and breathing. While naloxone, Narcan, might be indicated given the pinpoint pupils and altered mental status suggesting opioid overdose, and oxygen is always good, the shallowly at 8 breaths per minute indicates inadequate breathing, respiratory depression. The most immediate and critical intervention is to secure the airway, often by inserting an oropharyngeal airway, OPA, to prevent the tongue from obstructing the airway, and then assist ventilations with a bag valve mask, BVM, to improve oxygenation and ventilation. Without adequate ventilation, other interventions will be ineffective, as oxygen is not reaching the lungs. Remember, Always manage the airway and breathing before addressing potential underlying causes or specific drug reversals. Question 4. A 45-year-old construction worker sustained a deep laceration to his forearm from a circular saw. He is bleeding profusely. Direct pressure with a sterile dressing has been applied, but the bleeding continues to soak through the dressing. What is the next most appropriate intervention? A. Apply a tourniquet proximal to the injury. B. Elevate the extremity above the level of the heart. C. Apply a second sterile dressing directly over the first. D. Apply pressure to a proximal arterial pressure point. Answer: C. Apply a second sterile dressing directly over the first. This question assesses the proper sequence for controlling severe external bleeding. When direct pressure with a sterile dressing is applied and the bleeding continues to soak through, the next step is to apply a second sterile dressing directly over the first and maintain firm, continuous direct pressure. Removing the initial dressing disrupts the clot formation that is attempting to stop the bleeding. Elevating the extremity can be an adjunct, and tourniquets are for uncontrolled hemorrhage when direct pressure fails, but a second dressing is the immediate next step. For example, if a patient is bleeding heavily from a wound, adding more absorbent material while maintaining pressure helps to bolster the initial efforts to stop the flow. Always reinforce dressings, never remove them. Question 5. You are assessing a 72-year-old patient who complains of sudden, severe, tearing back pain that radiates to his abdomen. He is pale and clammy, and his radial pulses are weak and unequal. His vital signs are BP 80/50 mmHg, HR 120 bpm, RR 22 bpm. What is your most immediate suspicion? A. Acute myocardial infarction. B. Kidney stone. C. Abdominal aortic aneurysm, AAA, rupture. D. Acute pancreatitis. Answer: C. Abdominal aortic aneurysm, AAA, rupture. This question tests your ability to recognize a critical, life-threatening emergency based on a combination of specific symptoms. The key phrases are sudden, severe, tearing back pain, radiates to his abdomen, pale and clammy, weak and unequal radial pulses, and significant hypotension. These symptoms are classic indicators of a ruptured abdominal aortic aneurysm, AAA, a condition where the main artery in the abdomen bursts, leading to massive internal bleeding and rapid shock. Myocardial infarction typically presents with chest pain, and kidney stones usually cause flank pain without hemodynamic instability or unequal pulses. Acute pancreatitis, while painful, doesn't usually cause immediate shock and unequal pulses. Prompt recognition and rapid transport are crucial for a patient with a suspected AAA rupture. Question 6. A 5-year-old child presents with a high fever, drooling, and difficulty swallowing. The child is sitting upright and leaning forward, struggling to breathe. Respiratory distress is worsening rapidly. Which intervention should be avoided? A. Administering humidified oxygen. B. Encouraging the child to lie flat. C. Transporting the child in a position of comfort. D. Preparing for advanced airway management. Answer: B. Encouraging the child to lie flat. This question focuses on managing a critical pediatric airway emergency, likely epiglottitis, and identifying harmful interventions. The key symptoms are high fever, drooling, difficulty swallowing, and sitting upright and leaning forward, struggling to breathe, which is known as the tripod position. This position maximizes airway opening for these patients. Encouraging the child to lie flat can cause their swollen epiglottis to obstruct the airway completely, leading to immediate respiratory arrest. For example, forcing a child with suspected epiglottitis to lie down could be fatal. Therefore, maintaining their position of comfort and avoiding any procedure that might agitate them or compromise their airway is paramount. Question 7. You are managing a 34-year-old male who was involved in a motor vehicle collision. He is unconscious and has a deformed left femur. His Glasgow Coma Scale, GCS, is 341, eye-opening verbal response motor response. What is the most appropriate initial oxygen delivery device? A. Nasal cannula. B. Non-rebreather mask. C. Bag valve mask with supplemental oxygen. D. Venturi mask. Answer: C. Bag valve mask with supplemental oxygen. This question assesses your understanding of oxygen delivery methods based on a patient's respiratory status and level of consciousness, particularly in trauma. A GCS of 341 indicates severe head injury and an unconscious patient who is likely unable to protect his airway or maintain adequate ventilation independently. A patient with such a low GCS needs immediate ventilatory support, not just supplemental oxygen. The bag valve mask, BVM, with supplemental oxygen allows for assisted ventilations, ensuring adequate oxygenation and ventilation by manually moving air into the lungs. Nasal cannulas, non-rebreather masks, and Venturi masks are for patients who can breathe adequately on their own but require higher concentrations of oxygen. Question 8. A 28-year-old male with a history of asthma is experiencing severe shortness of breath. He is anxious, speaking in one-word sentences, and has audible wheezing. His SpO2 is 88% on room air. After administering oxygen and assisting him with his prescribed albuterol via nebulizer, his condition does not improve significantly. What is your next most appropriate intervention? A. Administer a second dose of albuterol via nebulizer. B. Prepare for endotracheal intubation. C. Administer epinephrine 1:1000 intramuscularly. D. Transport immediately without further intervention. Answer: C. Administer epinephrine 1:1000 intramuscularly. This question tests your ability to differentiate between a severe asthma exacerbation that is not responding to conventional therapy and the need for a more aggressive intervention, often involving anaphylaxis protocols. While a second dose of albuterol is common, the patient's severe distress, single-word sentences, and lack of improvement with initial therapy strongly suggest a more significant airway compromise, possibly with an anaphylactic component or a severe asthmatic crisis not responding to bronchodilators. Epinephrine is a powerful bronchodilator and vasoconstrictor that can rapidly improve respiratory distress in such critical situations. For example, if a patient is experiencing severe, life-threatening bronchospasm that doesn't respond to albuterol, epinephrine can be a life-saving intervention by acting directly on the sympathetic nervous system to open the airways and support blood pressure. Question 9. You are managing a 7-year-old child who fell from a tree and sustained a severe open fracture to his left tibia and fibula. He is alert and crying, but his distal pulses are weak and his foot is pale and cool to the touch. What is the most important immediate intervention after immobilizing the fracture? A. Administer pain medication. B. Cover the open wound with a sterile dressing. C. Realign the extremity if possible. D. Assess for sensation and motor function. Answer: C. Realign the extremity if possible. This question assesses the critical skill of recognizing and addressing neurovascular compromise in a severe extremity injury. While covering the wound and assessing neurovascular function are important, the key phrases "distal pulses are weak" and "foot is pale and cool" indicate potential compromise to blood flow, which can lead to permanent tissue damage. Realigning a severely angulated, bent extremity, even an open fracture, is often indicated to restore circulation and alleviate pressure on nerves and blood vessels, even if it is painful. For example, if a broken bone is severely displaced and cutting off blood flow to the limb, it's far more urgent to restore circulation by realignment than to just manage pain or cover the wound. Always prioritize restoring distal circulation in such injuries. Question 10. A 60-year-old female complains of generalized weakness, dizziness, and a fluttering sensation in her chest. Her skin is warm and dry. Vitals: BP 110/70 mmHg, HR 150 bpm, irregular, RR 18 bpm, SpO2 98%. ECG shows a narrow complex tachycardia with an irregular rhythm. What is the primary concern for this patient based on her symptoms? A. Imminent cardiac arrest. B. Inadequate cardiac output. C. Myocardial infarction. D. Stroke. Answer: B. Inadequate cardiac output. This question tests your understanding of how rapid or irregular heart rhythms affect the body's ability to perfuse tissues. The key phrases are generalized weakness, dizziness, and a fluttering sensation, combined with an HR 150 bpm, irregular, and a narrow complex tachycardia. While not in immediate arrest, a heart rate of 150 bpm, especially if irregular, can significantly reduce the heart's filling time, leading to inadequate cardiac output. This means the heart isn't pumping enough blood to meet the body's demands, causing symptoms like dizziness and weakness due to poor perfusion. For example, if a car engine is running too fast but not effectively pushing fluid, it won't be able to cool the engine properly. Similarly, a very fast, irregular heart can't effectively push blood. The primary concern is the impact of the rapid, irregular rhythm on the body's overall blood flow. Question 11. You are assessing an alert and oriented 8-year-old male who was stung by a bee. He states he is allergic to bees and has a history of anaphylaxis. He has hives over his trunk, facial swelling, and reports feeling tight in his chest. His SpO2 is 94% on room air. What is the most appropriate immediate action? A. Administer diphenhydramine, Benadryl, orally. B. Apply oxygen via nasal cannula. C. Assist with the patient's autoinjector of epinephrine. D. Monitor vital signs and transport rapidly. Answer: C. Assist with the patient's autoinjector of epinephrine. This question assesses the recognition and immediate management of anaphylaxis, a life-threatening allergic reaction. The key clues are the bee sting, history of anaphylaxis, and current symptoms of hives, facial swelling, and tightness in the chest, indicating systemic involvement and potential airway compromise. Epinephrine is the definitive, life-saving treatment for anaphylaxis because it reverses bronchospasm, constricts blood vessels, and reduces swelling rapidly. While oxygen is helpful and monitoring is important, delaying epinephrine for a patient experiencing signs of anaphylaxis, even with a relatively good SpO2, can have severe consequences. For example, waiting for symptoms to worsen before giving epinephrine could lead to complete airway obstruction. Question 12. A 29-year-old female is found unconscious in her bedroom with an empty bottle of prescription sleeping pills next to her. Her respirations are slow and shallow. You apply a non-rebreather mask at 15 liters per minute. Her SpO2 remains 88%. What is the next most appropriate intervention? A. Begin assisting ventilations with a bag valve mask, BVM. B. Administer activated charcoal orally. C. Insert a nasopharyngeal airway, NPA. D. Obtain a 12-lead ECG. Answer: A. Begin assisting ventilations with a bag valve mask, BVM. This question tests your ability to prioritize life-saving interventions based on a patient's respiratory status, especially in a suspected overdose. The key phrase SpO2 remains 88% despite supplemental oxygen indicates that the patient is not adequately ventilating or oxygenating on her own. Applying a non-rebreather mask provides oxygen but does not address inadequate respiratory effort. Therefore, The next most appropriate intervention is to begin assisting ventilations with a bag valve mask, BVM, to ensure adequate oxygen delivery and carbon dioxide removal. For example, if a patient is breathing too slowly or too shallowly, simply providing oxygen won't help if their lungs aren't moving enough air. The BVM provides the necessary mechanical assistance to breathe for them. Question 13. You are assessing a 5-year-old child involved in a motor vehicle collision. The child is secured in a car seat, appears pale, and is quiet. She responds to painful stimuli by moaning. Her capillary refill time is greater than 3 seconds. The child's parents are uninjured and concerned. What is the most reliable indicator of compensated shock in this pediatric patient? A. Pale skin. B. Moaning to painful stimuli. C. Quiet demeanor. D. Capillary refill time greater than 3 seconds. Answer: D. Capillary refill time greater than 3 seconds. This question assesses your knowledge of pediatric shock, particularly the subtle signs of compensated shock in children. While pale skin is a general sign of poor perfusion, and moaning/quiet demeanor can indicate altered mental status, capillary refill time is a highly reliable and objective indicator of peripheral perfusion in children. A capillary refill time greater than 2 to 3 seconds indicates that the body is shunting blood away from the extremities to vital organs, a compensatory mechanism for shock. Children can maintain their blood pressure for a long time during shock, making other signs less reliable until decompensation is advanced. For example, a child may appear stable but have cold, mottled skin with delayed cap refill, indicating they are heading towards decompensated shock. Question 14. An adult patient is experiencing a sudden onset of severe difficulty breathing. You observe paradoxical chest wall movement. This finding most strongly suggests A. A pneumothorax. B. Flail chest. C. Acute bronchitis. D. Diaphragmatic rupture. Answer: B. Flail chest. This question tests your recognition of specific chest trauma findings. The key phrase paradoxical chest wall movement is a classic, definitive sign of a flail chest. A flail chest occurs when 2 or more ribs are fractured in 2 or more places, creating a segment of the chest wall that moves independently of the rest of the rib cage during respiration. Instead of expanding outward with inhalation, the flail segment moves inward and outward with exhalation, impairing effective ventilation. While pneumothorax and diaphragmatic rupture are serious, they do not typically cause paradoxical movement of the chest wall itself. For example, if you see one part of the chest sinking in when the rest of the chest expands, that's exactly what paradoxical movement looks like in flail chest. Question 15. You are treating a 45-year-old male who is seizing. He has a known history of epilepsy. His seizure has lasted for 7 minutes, and he is still actively seizing. What is the most important immediate intervention? A. Insert an oropharyngeal airway, OPA, to prevent tongue biting. B. Administer supplemental oxygen via non-rebreather mask. C. Protect the patient from injury. D. Prepare to administer a benzodiazepine per protocol. Answer: C. Protect the patient from injury. This question assesses the immediate priorities in managing an actively seizing patient, particularly focusing on safety. While administering oxygen and preparing for medication are important, the most immediate and critical intervention when a patient is actively seizing is to protect them from injury. This involves moving objects away from the patient, patting their head, and ensuring their environment is safe, without attempting to restrain them or force an airway adjunct. For example, if the patient is hitting their head on a nearby table, moving the table is the first step. Securing the environment prevents further harm during the seizure. Question 16. You arrive at the scene of an industrial accident where a 30-year-old male has his arm impaled by a large metal rod. The rod is protruding significantly from both sides of his forearm. The patient is conscious and anxious, and there is minimal bleeding. What is the most appropriate management for the impaled object? A. Carefully remove the rod to assess the wound. B. Cut the rod as close to the skin as possible to facilitate transport. C. Stabilize the rod in place with bulky dressings. D. Apply direct pressure to the wound around the rod. Answer: C. Stabilize the rod in place with bulky dressings. This question tests the correct management of an impaled object. The most appropriate management for an impaled object, especially one that is large and protruding significantly, is to stabilize it in place with bulky dressings. Removing or cutting the object can cause further damage to blood vessels, nerves, and tissues, and can also increase bleeding. Stabilizing the object prevents it from moving and causing additional internal trauma during transport. For example, trying to remove a knife impaled in someone's chest could sever a major artery, whereas leaving it in place and securing it prevents further damage until surgery. Question 17. A 78-year-old female complains of sudden onset of left-sided weakness and slurred speech. Her blood glucose is 120 milligrams per deciliter. Her symptoms began approximately 45 minutes ago. Which of the following is the most critical piece of information to obtain rapidly for hospital staff? A. Her full medical history. B. The exact time of symptom onset. C. Her last oral intake. D. The presence of any allergies. Answer: B. The exact time of symptom onset. This question highlights the critical importance of a specific piece of information in managing a suspected stroke. The key phrases, sudden onset of left-sided weakness and slurred speech combined with symptoms beginning approximately 45 minutes ago, strongly suggest a stroke. For stroke patients, the exact time of symptom onset, last known normal, is the most critical piece of information because it determines eligibility for time-sensitive clot-busting medications, thrombolytics. There is a narrow therapeutic window for these treatments, typically within 3 to 4.5 hours from symptom onset, and accurate timing is essential for the hospital to make treatment decisions. For example, if a patient arrived at the hospital and nobody knew when their stroke started, they might miss the window for life-saving treatment. Question 18. You are called to a local park for a 20-year-old female who collapsed after jogging. She is unresponsive. Your initial assessment reveals she is pulseless and apneic. High-quality CPR is initiated. What is the recommended compression to ventilation ratio for a single rescuer performing CPR on an adult? A. 15 compressions to 2 ventilations. B. 30 compressions to 2 ventilations. C. 30 compressions to 1 ventilation. D. Continuous compressions without pauses for ventilations. Answer: B. 30 compressions to 2 ventilations. This question tests your fundamental knowledge of adult CPR guidelines. The recommended compression to ventilation ratio for a single rescuer performing high-quality CPR on an adult patient is 30 compressions followed by 2 ventilations. This ratio aims to maximize chest compression fraction while still providing adequate oxygenation. Maintaining consistent, high-quality compressions with minimal interruptions is crucial for maximizing blood flow to the brain and heart during cardiac arrest. For example, ensuring you only pause briefly for 2 quick breaths keeps the blood circulating effectively to vital organs. Question 19. A 35-year-old male is found unresponsive at the bottom of a flight of stairs. His airway is partially obstructed by his tongue, and he is breathing shallowly. Which method should be used to open his airway? A. Head tilt, chin lift maneuver. B. Jaw thrust maneuver. C. Oropharyngeal airway, OPA, insertion. D. Nasopharyngeal airway, NPA, insertion. Answer B. Jaw thrust maneuver. This question assesses your understanding of airway management techniques, particularly in the context of suspected spinal trauma. The key clue found unresponsive at the bottom of a flight of stairs suggests a potential spinal injury. In such cases, the jaw thrust maneuver is the preferred method to open the airway because it minimizes cervical spine movement, unlike the head tilt, chin lift maneuver which can exacerbate a spinal injury. While OPAs and NPAs are airway adjuncts, the initial manual maneuver to open the airway in suspected trauma is the jaw thrust. For example, if you suspect a patient fell and injured their neck, moving their head could cause further damage, so the jaw thrust is the safest way to open their airway. Question 20. A 16-year-old male is experiencing acute onset of dyspnea and sharp, pleuritic chest pain after lifting weights. On assessment, you note diminished breath sounds on the right side and he is tachypneic. His SpO2 is 90% on room air. What is the most likely cause of his symptoms? A. Myocardial infarction. B. Asthma exacerbation. C. Spontaneous pneumothorax. D. Pulmonary embolism. Answer C. Spontaneous pneumothorax. This question tests your ability to differentiate causes of acute respiratory distress based on specific presenting signs. The key clues are a young, healthy male, 16-year-old, acute onset of dyspnea and sharp, pleuritic chest pain after exertion, lifting weights, and diminished breath sounds on the right side. This constellation of symptoms is highly indicative of a spontaneous pneumothorax, where air leaks into the space between the lung and chest wall, causing the lung to collapse. Myocardial infarction is less common in this age group with these specific symptoms. Asthma typically involves wheezing bilaterally, and pulmonary embolism is often associated with risk factors like immobility or oral contraceptives. A spontaneous pneumothorax is a common cause of sudden chest pain and shortness of breath in young, tall, thin males, especially after strenuous activity. Question 21. You are called to a hospice facility for a 90-year-old patient with end-stage COPD who is experiencing severe respiratory distress. The patient has a valid DNR, do not resuscitate, order posted prominently. Her daughter is present and states, please do everything you can to make her comfortable, but do not do CPR. What is the most appropriate action for you to take? A. Initiate full resuscitation efforts, including CPR and intubation. B. Provide supportive care, such as oxygen and position of comfort, but no CPR. C. Contact medical control immediately for clarification before any intervention. D. Leave the scene, as per the DNR, as no interventions are permitted. Answer B. Provide supportive care, such as oxygen and position of comfort, but no CPR. This question assesses your understanding of DNR orders and palliative care. A DNR order specifically means do not resuscitate, which prohibits interventions like CPR, defibrillation, or advanced airway procedures to restart the heart or breathing if it stops. However, it does not mean do not treat. The patient and family are requesting comfort care. Therefore, the most appropriate action is to provide supportive care, such as administering oxygen if indicated, ensuring a comfortable position, and managing symptoms like pain or anxiety, but specifically avoiding resuscitative measures. For example, if a patient is struggling to breathe, providing oxygen and sitting them upright would be appropriate comfort measures, even with a DNR. Question 22. A 40-year-old male with a history of alcohol abuse is found confused and disoriented. His skin is warm and moist. His breath has a fruity odor. His blood glucose level is 480 milligrams per deciliter. What is the primary underlying problem contributing to his current mental status? A. Alcoholic ketoacidosis. B. Hypoglycemia. C. Diabetic ketoacidosis, DKA. D. Hyperosmolar hyperglycemic state, HHS. Answer: C. Diabetic ketoacidosis, DKA. This question tests your ability to identify the specific type of diabetic emergency based on a combination of signs. The key clues are confused and disoriented, warm and moist skin, fruity odor to the breath, and a significantly high blood glucose level, 480 mg per deciliter. The fruity odor is caused by ketones, which the body produces when it starts breaking down fat for fuel due to a lack of insulin. This is characteristic of diabetic ketoacidosis, DKA, a serious complication of uncontrolled diabetes where the body produces excess blood acids, ketones. Alcoholic ketoacidosis might have a fruity odor but typically lower glucose. Hypoglycemia would be low blood glucose, and HHS typically has much higher glucose levels and no fruity breath. Question 23. You are assessing a 6-year-old child who ingested an unknown number of pills. The child is alert and crying. The parents are unsure what the pills were, but state they were small, round, and white. What is the most immediate and appropriate action? A. Induce vomiting with ipecac syrup. B. Administer activated charcoal. C. Contact Poison Control Center. D. Monitor vital signs closely for changes. Answer: C. Contact Poison Control Center. This question assesses the critical first step in managing a poisoning, especially when the substance is unknown. The most immediate and appropriate action when a child has ingested an unknown substance is to contact the Poison Control Center. They have expert toxicologists who can identify potential toxins based on the description of the pills and patient symptoms, and provide specific, up-to-date treatment recommendations. Inducing vomiting or administering activated charcoal without knowing the substance or dose can be harmful or ineffective. For example, if the pills were corrosive, inducing vomiting would cause further damage. Always call poison control first. They are the experts in these situations. Question 24. You are treating a patient experiencing severe respiratory distress who is unable to speak in full sentences. You hear diffuse wheezing and bilateral rhonchi on lung auscultation. What is the best description of this patient's respiratory status? A. Bradypneic with crackles. B. Tachypneic with evidence of upper and lower airway obstruction. C. Hyperpneic with absent lung sounds. D. Dyspneic with signs of pneumonia. Answer: B. Tachypneic with evidence of upper and lower airway obstruction. This question tests your ability to synthesize assessment findings to describe a patient's respiratory status accurately. The inability to speak in full sentences indicates significant respiratory distress. Diffuse wheezing points to lower airway obstruction, bronchospasm, and bilateral rhonchi indicates secretions in the larger airways, often associated with an upper airway or large bronchial obstruction/inflammation. While not explicitly stated, severe respiratory distress typically includes tachypnea, rapid breathing. This combination of findings best describes a patient struggling with both upper and lower airway issues. For example, wheezing sounds like a whistle from narrowed lower airways, while rhonchi sound like coarse crackles from mucus in larger airways, together indicating widespread breathing difficulty. Question 25. You are providing care for a patient who suffered a severe burn to their left arm. The burn is full thickness, 3rd degree, over a large area. After ensuring scene safety and stopping the burning process, what is the most appropriate initial dressing for the burn? A. Apply a wet, sterile dressing. B. Apply a dry, sterile dressing. C. Apply a petroleum-soaked gauze. D. Apply a burn cream or ointment. Answer: B. Apply a dry, sterile dressing. This question tests your knowledge of proper burn management, particularly for full-thickness burns. For large, full-thickness, third-degree burns, the most appropriate initial dressing after stopping the burning process is a dry, sterile dressing. Wet dressings can lead to hypothermia, especially in large burns, and can cause maceration of the tissue. Petroleum-soaked gauze and burn creams are not typically used in the pre-hospital setting for initial management of large burns, as they can interfere with hospital assessment and treatment. A dry, sterile dressing helps to protect the wound, prevent infection, and conserve body heat. Think of it like a protective barrier for the damaged skin while en route to definitive care.